talk about a patient, Miss Suja. She is 52-year-old and she came to us many years after her diagnosis of uterine cancer. She had undergone a hysterectomy followed by radiation therapy, and she approached to us many years after that with a concern of post radiation proctitis, meaning she had received radiation therapy after her hysterectomy. And because of that irradiation that happened, the area around her anal canal had a lot of inflammation and chronic inflammation. Because of this, she had an urgency to pass motion, less well formed stools, like slightly more loose stools and frequent stools, pain and burning in perianal region. This was a thing for which she had like conventional follow-ups, but which was just left to be treated and managed on her own with diet, lifestyle, and few anti-inflammatory medications. But she was in lot of suffering. At this point of time, Ayurveda assessed her situation of chronic inflammation, put her through a protocol of diet, lifestyle, medicine, and therapy. And she really did well. And after many years that she could have a good and a well-formed motion, proper digestion, she was less anxious, was able to sleep well, and overall quality of life improved. Let's take another case who is 62-year-old. Completed her radical mastectomy followed by chemotherapy and radiation. She received taxane based chemotherapy. Taxane is such a class of drug which leaves one with peripheral neuropathy. While she managed somehow during that acute phase, but even many years later, she kept on having concerns on tingling, numbness, and weakness over her legs. Chronic peripheral neuropathy was something that was troubling her. Along with that, she had undergone radiation. And at the part where radical mastectomy was done, the area around that was fully irritated and was very itchy, very dry, which is known as radiation-induced dermatitis. Again, and a situation which was not fully and optimally treated. It had some outcomes, but patient was still suffering. So in this situation, we had two scenarios: chemotherapy-induced delayed peripheral neuropathy as well as radiation-induced dermatitis. Both the areas are definitely called for a need for Ayurveda rehabilitation. Ayurveda took care of these two situations very well, again through an approach of diet, lifestyle, external therapies, internal therapies, and ointments, applications, etc. With these two situations, we understand that acute and delayed side effects of conventional therapies can be very well treated with Ayurveda. Ayurveda cancer rehabilitation is not just limited to treating side effects. We understand that while the patient is considered tumor free or cancer free at that particular point of time, but patient has undergone two major situations in his or her life. One, the process of carcinogenesis that has happened, and the other is to deal with this carcinogenesis. Therapies like chemotherapy, radiation, immunotherapy, surgery, etc., hormonal treatments, etc., have been administered in his or her body. So, both of these situations, the disease as well as the treatment, allows and leaves lot of insults or mutations or furthermore changes or imprints on the cells and tissues of the body, which are likely to become more cancerous, which are likely to get into relapse, recurrence. What does the current protocol do? Current protocol of cancer management asks the patient to go for screening and surveillance, meaning at every point of time, 1 year, 3 year, or 5 year, some invasive investigations keep happening to check that after carcinogenesis and after being treated for cancer, is there any cell or tissue which is showing some more growth or tumor. But the changes again that are happening in the body are at such a nano or a micro level that they cannot be picked up through these tests. Only when it surfaces out, the investigation is able to pick up. But what do we do in that period of time? Do we just wait and watch for something to emerge? Can we do something more for these patients? Yes, Ayurveda's wisdom can be translated in such a situation. We can work with the patient and address all the changes that have happened in the body by looking at their very basic vital parameters of health. Are they eating better? Are they digesting better? Motions, urine, evacuation of all kinds, plus mental state, sleep. You can imagine the state of mind of a cancer patient, and that itself can initiate trigger for lot of things in the system. Also, energy, vitality, are they able to function as before? Cumulative burden of poor quality of life itself is said to be one of the predictor and said to be a prognosis of cancer, poor prognosis of cancer. In that situation, rehabilitation is not just reducing the side effects. We can work with the patient to reduce this inflammation, and this could be very well evaluated and objectively measured through conventional parameters like CBC, ESR, CRP, neutrophil lymphocyte ratio, various tumor markers, and so on. Also, we do understand, we do see that any patient of cancer never comes with just one plain and simple diagnosis. It is always like bunch of things that he or she is suffering, like diabetes, hypertension, metabolic syndrome, osteoarthritis, GERD, many situations that are underlying, which are happening in and around the cancer proliferation that has happened. That itself, Ayurveda can treat very well. Ayurveda can reduce the burden of comorbidities, reducing glycemic index, insulin resistance, and that whole aspect of inflammation and immune system, which leads to no cell changes and cellular environment. So, rehabilitation, in my view, from an Ayurveda perspective, is very important and very beautiful if it is very well done with a clinical mindset which looks into the patient as a whole, understands the cancer, type of cancer, organ involved, cancer treatments and its impact, comorbidities, and any other situations that are going to contribute towards relapse or relapse at same site, relapse at other site, or any other organ. So, all in all, I do believe that cancer rehabilitation is not just for well being and wellness, it has a serious objective for which a patient can come into AyurVAID, and we can help to win over this and help to contribute towards a better and a healthier life.